Hi there, welcome back to my YouTube channel. Thank you so much for joining me. Please remember to like the videos here on YouTube, subscribe to the channel and click the notifications. Also check out the playlist for more videos to do with cosmetic surgery. So today I'm going to be talking to Emma about Botox and fillers. Hi there, thank you so much for joining me again. Please just introduce yourself and just tell me about the clinic that you have there in London.
Hello. My name is Emma Osborne. I've been in the beauty business for many years now. I mainly deal with non-surgical procedures.
Okay.
I've got a clinic that I'm based in a couple of days a week in Mayfair in London. And I'm also one of the trainers there as well. So I've got a training academy of my own, which is called Skin Clinics London. I am the owner of that.
That's brilliant. Okay, so today we're going to have a chat about Botox and fillers. So just tell me, this procedure, do you need to be qualified to do this? What sort of qualifications would you need?
Yes, you do. Definitely you do. Especially now, the government's actually putting a bit of more of a hold on it, which I'm actually really happy with, because over the lockdown, just about everyone, your mum, your grandma, everyone was learning online. Just to
Oh,
tell you, how
really?
can you? You can't learn needles online and inject people's faces.
Wow.
So now they have to pass the level 7, which is the foundation and the pathway of aesthetics, which is very good. I think it's really good. I know some people don't agree, but I think it's safe for the people. Once they've learned
Okay.
that, then they can go ahead with the advanced and the other techniques as well.
Okay. Right. Okay. But Botox, what exactly is it? Would you be able to explain to me what Botox is?
Okay, so it's, as they call it, a poison substance. But is it poison? Because anything too much can be poison anyway. So you only use a little bit. It was actually created for migraines.
Okay.
So when they were injecting people on their forehead for migraines, they actually realised that the lines were disappearing. So that's how Botox actually came in the space for the cosmetic area. But it's very good. You can use it for just about everything, even for cross eyes. It works really well for them.
Okay.
For gummy smiles, masseter, for people that grind their teeth at night, so you can have a little bit of
Okay.
Botox there. And not only for the masseter, it will actually stop the grinding, it will actually slim the face down as well. For
Okay.
over sweating, you can have it done under your armpits. So there's a lot of medical reasons that it can be used for as well. Obviously, I'm non-med, so I can't promote it for the medical, but I
Mm.
can do
Mm.
that as well because I've done the
Okay.
advance on that.
Okay, good. So, what's the difference between Botox and fillers, or are they the same thing?
No, they're not the same thing. Botox is you'll inject someone, a couple of days later it will start kicking into to their skin. The
Hmm.
results we show in 10 days' time. With dermal fillers, you pretty much see the results straight away. However,
Okay.
with dermal fillers, you do need to be a bit more careful, I think, anyway, on where you're injecting because you can get into an artery, especially with the nose.
All right. Okay.
There's been a few incidents where people that haven't been very experienced have actually injected in the nose and it can cause blindness as well.
Oh God.
So they do need to know. I don't want to scare anyone, but they go to a really good practitioner and go to someone that knows what they're talking about.
Right. Okay.
Yeah.
Wow. I've never heard that one before.
Yeah.
So
Oh,
tell me,
yeah.
is
And
there?
from there as well, if they put Botox there, if they stick it in the wrong area without aspirating, yeah, it can really affect someone's face
Okay.
and their vision as well.
So tell me, can anybody have this done, or are there people that you would say this is not suitable for you for?
No, anyone can have fillers done, really, and it's suitable just for everyone. Because I mean, 1 ml is really a very small amount, maybe half a teaspoon. It's very, very
Okay.
tiny. But a person, an elderly person, mature skin person, sometimes comes along and they just wants 1 ml. I'm thinking it's not going to make much difference. They do need
Mm,
a bit more to actually see a full effect.
okay.
However, saying that now I'm doing threading and that's absolutely amazing. It's not Botox and it's not filler. So you're just
Okay.
lifting the skin and it's
Yeah.
like a facelift. So that's a really good one that's actually picked up really well for me.
Okay. Brilliant. Okay. So tell me, Is there any like downtime? And like, say I was going to get my lips done, would it be painful having the injections done? Because I've
Okay.
seen videos before and it does look like it could be painful for some people.
It can be pain because lips is the most sensitive area. So I normally do numb it very well.
Okay.
Because when the client's really comfortable, it makes life easier for any practitioner to do it very quickly. Because once you start one side, really you're supposed to move on the other side very quickly. Because as soon as you do one, it starts swelling. So you want to see them match. So you do it very quickly. The process itself, in with the numbing, it doesn't take more than half an hour really. And it does swell up the next day, but then it goes down. So I get calls the next day, oh, my lips are really big. Yeah, I did tell you that. But it will go down. And a week later, they've gone down. I said, yeah, I know, I did tell you. They go down to the size that it would be straight after the procedure. Because you see, you know what size it's going to be, but they do swell up. Obviously, the more you inject, especially the Russian technique, because you're using more injection areas really for it, it does swell up a little bit more. But it is a nice outcome, which is really good.
Okay, great. And so how long would it last, say, if I was doing like my lips? How often would I have to get this done? It's not going to last forever, is it? So
no, it's not forever. It's temporary. Normally, it depends on their metabolism, their system. If it's someone that they work out quite often, every day, if they're running every day, usually I would say for them it would be about 6 to 7 months, but normally about 9 months.
Okay, so it's quite long then. I was thinking maybe it was only like a month or so.
No, it is quite long. Whereas
Okay,
Botox is
that's great.
That lasts for between 4 to 5 months.
Okay. So would there be any like really negative side effects that you've seen people have? You know?
I not from someone that I've done it for, but I have seen people that I've had to dissolve under their eyes. Well, and really the tear trough, where it's like you need some fillers because there's been a great big pouch, like it's stuck a hollow. Using a needle in that area is not really, to me, it's not really ideal to do. Not only it's more dangerous, and you can't actually get to the areas that you really want. I use a cannula and it's much more safer, much more effective, no bruising, and it's a very quick procedure. So this lady came to me and it was all lumpy. I'm not even sure what they used as well, because really we should only be using TSL in the UK. So I did dissolve that and I had to wait for a couple of weeks, and then she came back and I did the proper way for her and she was happy in the end.
Okay, that's great, because that was actually going to be my next question. Like, I'm not sure exactly if it's the same thing, but if I had that done and then I decided, oh God, I don't like that, can you actually reverse what you've done?
Yes, you can. With fillers, you can. Yes, you can have it dissolved. With Botox, like recently one of my clients had Botox done at the hospital by a doctor, and her eyebrow dropped. And she sent me pictures. Well, what can I do? I said, well, really, I don't really know. You can't really do much. I said, have you contacted the doctor? Yes, I have, but they can't do much. It stays for a while. Sadly, there's not much you can do. Sorry, place
so
it in
the
the wrong
eyebrow
area.
kind
place
of
it in the wrong area.
Wow, that's crazy. Okay, so is it an expensive procedure to do? What would someone expect to pay?
Not at all. I mean, with dermal fillers for lips, it's normally about between 180 and 190 pounds. Although I know I've seen it on Facebook for 50 pounds. I'm not really sure what they're using or where they're doing it. It's always best to go to someone that's been recommended, and if you've seen their work as well on Instagram, or someone that you can trust, because this is your face. You don't
Exactly.
£100 extra and know they're going to come out well. And teardrop as well, because I use the high end. Obviously it's going to cost you a little bit more, but 250 for 1 mil of teardrop, I don't think it's that expensive if you know you're going to have a great outcome. It just varies.
Brilliant, Emma. Thank you so much for joining me today, talking to me about that. It's been great speaking to you.
It's been lovely speaking with you right now. Thank you.
Thanks. Bye bye.